Hi everyone, it's Niall at Dentistry on the Clyde here, and I just wanted to spend a wee bit of time today talking about one of the kind of most common cosmetic type procedures that we offer at the practice that a lot of people maybe hear an awful lot about, but maybe don't know an awful lot about what's involved in the procedure, what it can be used for, and that is dental veneers. So veneers, let's say, very kind of common procedure in the sense that a lot of people know a lot about them. I've heard a lot about them, but maybe don't necessarily know what's involved or what they can be used for. They are commonly done for cosmetic reasons, but a lot of the time veneers can also be done for kind of functional reasons as well, and some of the kind of reasons behind that are ways of trying to change your bite, shape the teeth slightly differently so you can eat and chew a wee bit more effectively. But yes, some of the most kind of common reasons for veneers is mainly changing the shape of the teeth. Quite a common kind of time when people opt for veneers is if they've got quite small teeth and then maybe want to kind of add a little bit more length, have more on show. Even if you have quite a kind of narrow jaw on the carpal jaw and you don't really show an awful lot of your teeth beyond your front, maybe 4 or 6 teeth. Veneers can sometimes be used further back there as well to kind of widen your smile, give you that kind of nice broad smile. A lot of the time you can use in teeth that are quite worn down, so it's something that does kind of happen over time with a lot of people, is that our teeth gradually do become a wee bit kind of worn or chipped on the edges. And veneers can be a great option for repairing those chips and edges, but also really kind of giving that a nice kind of cosmetic result. And also they can also be used in teeth that are quite discoloured. So a lot of time people maybe want to kind of brighten their teeth. Tooth whitening is always our kind of number one option for that, but there is a kind of limitation sometimes as to how white some teeth will go, and certainly veneers can be used as an adjunct to that if you're maybe wanting that slightly whiter smile than what can be achieved with tooth whitening. So veneers can be used for a whole host of reasons like those ones mentioned, and also for a couple of other reasons as well. Though one of the kind of big things that a lot of people kind of worry about with veneers, and particularly kind of these days because you can see a lot of it on kind of social media, is that they have this kind of preconception that veneers involves kind of really cutting down a lot of your tooth structure and kind of making these small wee kind of stumps, wee kind of shark-like teeth. You maybe can see on Instagram or TikTok, things like that, and that's what's needed to ensure that veneers can go over the top of your teeth. A lot of the time that's not how you would do veneers in this country. They're more like a full kind of crown preparation. So veneers a lot of the time are just basically like a small kind of thin laminate that's just added onto the kind of surface, the outer surface of your teeth. And a lot of the time these days with kind of modern materials and advances in terms of technology, we can almost kind of do veneers with little to no preparation of your own natural tooth, which just kind of means long term less likely to have issues and problems in terms of things chipping, breaking or sensitivity, but also longevity is going to be a lot better as well, because when you get a veneer that's stuck well to a lot of your own natural tooth structure, it's really quite a kind of strong union, strong join between the two there. Let's say one of the kind of big other concerns that a lot of people have is that how will I know I like the veneers and how they look and how that changes my smile, my appearance, etc. So a lot of the time what we can do within the practice, we can do something called digital design, whereby we'll see you for your initial consultation, we'll talk you through the kind of process, what could be done potentially with regards to veneers. We'll maybe take at that appointment a scan of your mouth or a couple of moulds, quite a lot of kind of photos, and from that we'll kind of come up with a design of essentially, after listening to what you want as well, how we want the teeth to be shaped, how we want them to look, and essentially maybe get you back a few weeks later and almost be able to kind of trial that in on your mouth. So before we even do any sort of real dentistry, if we do have to do any sort of preparation or minimal preparation, before we even do any of that, we can actually kind of trial in the smile in terms of how it's going to look, and so you basically get to kind of see that what can be achieved before you commit to anything. If they even want to make a couple of wee kind of changes or tweaks to that, we can do that and all the kind of temporary stuff before we then even go on to anything more permanent. So that's quite a good way that we can kind of combine showing you how things will look, what kind of preparation, if any, is going to be needed to achieve that look, and then you just kind of know that, yeah, this is hopefully what you're after in terms of kind of getting that nice kind of smile, whether it be a bright white wider smile, or whether it's something that a wee bit more natural, you in a good day, or you 20 years ago potentially, then yeah, we can kind of tailor every sort of the treatment to yourself really. So if that's something you're interested in, like I say, you know how to kind of get in contact, the usual kind of channels, phone, messaging, and get in touch with one of our smile advisors, and they'll be able to run you through the next kind of stages from there.